Leaders at Abilene stepping up to the podium this morning, giving updates on hospital capacity, personnel status, and morale. Catherine Garcia gives us the highlights.
As West Central Texas lies miles from a coastal city, Abilene's medical leaders are taking advantage of what they believe can keep their community safe. And that is time. President and CEO of Hendrick Health System, Brad Holland, says the hospital is preparing its capacity.
We started closing outpatient facilities and reducing volume to free up PPE, as well as staff to meet a potential surge.
Announcing Hendrick now has the resources to test COVID-19 patients in-house.
We're able to screen you, we're able to swab you, and we're able to get test results within a day.
Hendrick also now requires all personnel to wear PPE. Across town, Abilene Regional Medical Center is making its own adjustments, says CEO Mike Murphy.
You know, we're working right now at Abilene Regional to open our 5th floor that's been closed for a few years, and we're looking at steps beyond that. Where else could we put beds if we needed to in the community?
Both hospitals say they are combating the possibility of layoffs or furloughs, but do say those outcomes are dependent on capacity.
And most likely, people will have reduced volume if there is reduced work to be done. So there is a likelihood of reduced hours and reduced pay.
The last ditch goal before a furlough would be to give them at least enough hours to cover their benefit costs, their payroll deductions for benefit costs. So we've had a few people that are right now this week, we're going through some discussions to see if they're willing to work elsewhere, or they may end up being furloughed for some period of time.
Dr. Stephen Lowry is a physician for Hendrick Health System. He commented on the governor's recent decision to postpone elective surgeries.
It's something that we take very seriously, and both hospitals have set up ways to determine the urgency of a surgery and whether or not it's acceptable to proceed.
Dr. Lowry weighing in on community leaders' decision-making on COVID-19 and those decisions' ramifications.
Projections on this are all over the map. By doing the things that we are doing as a community, I think we are much more likely to see that best-case scenario.
In Abilene, Catherine Garcia, KROBC, Abilene's local news.